Good afternoon from wherever I am. I do hope all of you are well, wherever you are. This is the nursing ministry. My name is Ludia Osita, a registered nurse, and I set up this platform to expose you to the world of nursing, both professionally and as a ministry. So you are welcome, whether you're a first-time viewer or a returning viewer. As always, I am grateful and you are welcome. Now, for the new viewers, kindly watch our previous episodes to understand where we are at today. For one video or one episode is a build-up from the previous one. Other than that, I welcome you all. Now, I'll just jump right straight into our today's topic. As you have seen, we are going to discuss what is called the crash cut, otherwise called the code cut, or the emergency cut. Now, you may see the picture to understand what exactly we're discussing today, but I'm going to dig deeper. And before I do that, I want you to understand that the discussion of today is all about organization. It is about planning. It is about being prepared, but more so a perfect coordination with an end game in sight. Now, this crash cut, if I have mentioned it before when I was talking about activation of the emergency response system, I did mention that when you press that call button, especially in the hospital, there is the team that comes from the emergency room or the critical care unit or the ICU, depending on what the system has planned. And when they are running, there is a certain tremor that we used to hear because they are running on ramps, not on staircases. So that tremor that I had mentioned, that sound was being made by this emergency cut because it is made of metal and it has 4 wheels, as you're going to see. However, not all crash cuts are made of metal. Others are made of hard plastic. But that tremor that I was talking about is being made by the crash cut. So when the team comes, when you activate an emergency response system in the hospital, they have to come running with this crash cut. They don't just come empty-handed. They come with the emergency cut. However, if you're outside the hospital and you have activated the emergency response system, shouted for help, and told that person you're crying out to, call 911 or call the ambulance. The ambulance is a mobile crash cut. It does not come empty to just come and pick the victim and rush them to hospital. It comes equipped with everything and probably more of what is in the crash cut, these things that you're going to discuss today. So whether you're in hospital or outside the hospital, there is an emergency crash cut available. It has to be there for life-saving measures. Now, this emergency crash cut or emergency cut or a crash cut or a cord cut is not just used for the cardiac arrest victims. It is used in emergency cases, as you are going to see, various emergency cases. So it contains everything that is required to save a life. Now, I did mention that our topic today is about coordination, about planning, about being organized, without which the life that you're trying to save would be impossible. So our emergency crash cut is so organized that when something is needed, it is found exactly where it is needed, in the quantity that it is needed, and even in the quality that it is needed. So before I jump right in, let's look at the Bible. There are various examples or books in the Bible that talk about how things are so organized, things are so well coordinated. For instance, the creation of the earth, the way God created things, it was so strategic that this one had to be there before the next one was created, before the next one was created. I had already also discussed about creation. Today, I want to look at a book in the Bible that made me really think truly. These are well-coordinated events that happened. And the end game of the book of Esther was to prevent a genocide, to prevent the annihilation of the Jews. But it did not just happen. God could have done it in one day, in an hour. He could have turned things around and saved his people, the Jews. But instead of that, there were events that were happening. One event after the other, well planned, well coordinated, in order to save these Jews. Let's look first at a king called King Xerxes in the first chapter of the book of Esther. This is a king who loved the finest of things in this world. He loved class. He loved wealth. He was not just any other king. He loved things being done with a preciseness, you know. Now, we're talking about the banquet that he threw. Before the banquet, he took 6 months, a whole 6 months, just to showcase his wealth in the kingdom. This is a huge kingdom with 127 provinces. But it takes 6 whole months entertaining the officials, the nobles, the princes of his kingdom, just to show them what he has, to show them his palace, to show them his military might, to show them what he has, the kind of food he has, the workers he has, how great, the majesty, the splendor of his entire kingdom. After 6 months, he decides that where the palace is based, the administrative center of the entire kingdom, it was at the citadel of Susa. He decides that for 7 days, I'm going to throw a banquet. For the least to the greatest, they're going to be coming here and drinking as much as they want. But when they were going, they were sitting on couches made of pure gold. What they were sitting upon was made of gold. The cups they were drinking from was made of gold, of different types, one after the other. Where the couches were seated upon, where the couches were laid upon was a pavement, and the pavement was mosaic. You know, if mosaic in art, like a combination of art designs. So he's taking the mother of pearl, putting a design, then marbles, connecting that, then a stone called porphyry, very expensive and hard to get stone. So all, and other precious stones. So you don't know whether there was diamond or any other kind of stone. That is what they were walking upon. That is the pavement where the couches were set upon. Now, if you know anything about the mother of pearl, these are precious, I wouldn't call them stone, precious items that are found in a seashell. When you go into the sea, you get a shell and open it up. The pearls are there, naturally made. So if we love pearls as jewelry, this king was using the pearls to create a mosaic on a pavement upon which people are going to walk upon. And other precious stones, that is where the couches were set upon. So these things were vastly available to the king. He was very wealthy. He loved the finest of things. Around them were pillars, marble pillars with white linen, blue linen. There was purple. There was silver rings, you know, holding this material. As in, he's made it very beautiful. For what? For a banquet where people would just come, drink anything they wanted, however much they wanted, for you to understand that he really had enough. That the least in the kingdom probably was used to cheap wine. But when they got there, the king had made an order that everyone should drink whatever they wanted. So they could get there and ask for the most expensive wine, and they would be given. Just the same way the greatest in the kingdom would drink is what the least in the kingdom could also drink. And not just a glass each and that is done. However much they wanted to drink, the king had given an order. That means he had enough of the finest. That is King Xerxes for you. You'd think that he was done. Even his wife, she was lovely to look at. Queen Vashti, she was lovely to look at. So on the 7th day when he's high on wine, what does he do? He thinks, I've displayed the wealth of my kingdom. I've shown these people everything. Bring my wife also. Let them look at her. So he loved the finest. He loved beautiful things. He loved glory and splendor and majesty. Nothing less than that. Hold that thought. We now look on the other side, a lady called Esther. Esther was a young girl, I'd call her a young lady, let me put it that way. But her background was the very opposite of what King Xerxes' background was all about. She's coming from a humble home. First of all, she's an exile. They'd been brought by King Nebuchadnezzar into that kingdom of the Medo-Persian kingdom. So where they are exiles, what we today call something related to a refugee, but really it was more of an exile because they'd been brought there by force. They did not run to the Medo-Persian kingdom for asylum. So they are there more or less between a slave, a refugee kind of a thing, but they are in that kingdom as that. She's living with her cousin who raised her up when her parents died. She was an orphan. So her cousin, Mordecai, is a gate man in the king's palace. So of course, luxury is not even something to think about in this case. They were just living life day by day because there's not so much wealth. You can imagine that. So she's an orphan, she's an exile, she's living with the bare minimum because of the cousin's earnings as a gate man. And then she doesn't know class, really, because of her background. And if she knew, she just knew. She was not living it. Now, a time comes when the king on this other end has sent his wife packing. That is Queen Vashti. So maybe a year goes by. In fact, it was around 4 years that went by. And then he decides, the people surrounding him noticed he was lonely. They advised him, call for the ladies. Let there be a pageantry from all the 127 provinces. Then from that pageantry, choose your wife from there. What did she do? Well, the king decided that was a good idea. So he went ahead and issued the verdict. The ladies were picked. Now, these ladies that are coming, they are all beautiful. For them to make it into this pageantry, they are all very beautiful ladies, and Esther being amongst them. So when they are coming, you wouldn't say that Esther was the most beautiful of them all. They were all beautiful. But what caught me in this case? I realized that if Esther was just signaled because she was living in the citadel of Susa, if they would have said, we have seen a beautiful lady, and they brought Esther to the king, chances are the whole plot would have been botched, and that is to save the Jews. Because somebody like Haman would have wondered, who is this lady that the king has fallen in love with to replace the queen? She's going to become the queen. Who is she? And those are the days when people would ask, whose child are you? Whose son are you? Remember David? King David would be asked, whose son are you by King Saul? So that kind of thing was there. They want to know the lineage. Whose child are you? Who is your father? And all. So Esther was not even like a fourth generation where she'd probably say, my father is from here, but my great-great-great-grandfather is a Jew. And then that would have exposed her. No. Her own father and mother were Jews. They were exiles there. And at that time, there's no way such a king with so much splendor and glory and loving the finest would have considered Esther the orphan. So in this case, the perfect coordination that you're seeing here, the perfect plan was that an pageantry was organized. That means Esther was camouflaged in between the entire harem of ladies that were coming. So it was difficult to even know who would end up being the queen. And so it at least allowed her to get into that first step and get into this palace. Once she got into the palace, another plan. They had to go through one whole year of beautification. I asked myself, what kind of beautification was this that took a whole year? January, February, March, April, May, June, December. They are being beautified. 6 months with oil of myrrh, 6 months with cosmetics. What kind of beautification is this? Now, for Esther, for the ladies, they were already beautiful. So I wondered for a moment, I thought it was too much to go through this entire process just to be beautified. I went searching to find out why. Why 6 months? What was there about the oil? What was there about the cosmetics? Only to understand This is a king that wanted the finest. He wanted splendor. He wanted glory. There's no way Esther would have been brought in that form, or even the ladies, but in this case, there was a plan. Esther is coming from a background that was just the bare minimum. You know, she was coming as she was, beautiful, yes, but she didn't have that class that at least the king would have considered her. If she came in that raw form, chances are the king would not have looked away. He would have chosen another bride. And again, the plan to save the Jews would have been botched. So at least the 12 months for beautification, much as I thought this was taking too long, I came to accept it was necessary when I understood that it was long enough to ensure that no lady was pregnant. Because there's no way they could come pregnant, maybe a month too later, or even 5, 6, 7, 8 months, get married to the king. That would have it would have removed the legitimacy of that, kingship lineage. Because the king cannot have a child, call that child a prince, who would probably take over after him, and yet the child was not his. So the long period of the beautification was more than just beautification. It was more than just applying oil, more than just putting on cosmetics. It was also buying time to ensure that none of these ladies was pregnant, and then pinning it on the king, then the king thinking that I've made this lady pregnant, and yet that is not his child. So it was, one, to ensure that none of the ladies was pregnant, so 12 months was necessary. 2, yes, for beautification, because they needed the ladies to look the part, to look like the queen, and not just any queen. The queen to this king who loved wealth, who loved glory, who loved splendor, who loved, showcasing the finest of things. So it needed time for them to look that part. Number 3, they had to know what was going on in the palace and in the kingdom. They were going to be queens. So they needed to know at least something about the political status of the kingdom, know the affairs of the palace, what goes on around them. Then, oil of myrrh has antiseptic, antibacterial properties, antibacterial and antifungal properties. No one was going to go before the king with any bacterial infection, with any fungal infection. They had to be treated. So soaking in this oil of myrrh day in and day out, which I understand was being imported. So it did not matter how many there were, how long it would take, but that soaking in the oil of myrrh was not just to make their skin glow, but also to treat them, to ensure that there's no infection. Because once again, this is a king who loved splendor, who loved glory, who loved wealth, who loved things to be just right. So now you understand that there was planning, there was coordination, at least to transform Esther from that lady who's coming from Mordecai's house. Once she got here, at least now she had an even greater chance. Apart from her beauty, she had all this preparation going on to at least help her qualify for the king. Now, another thing, the favor that she had this favor with a man called Haggai. Another strategic coordination, because now she could have a conversation with Haggai, because by the time it got to a chance to show up before the king, after the 12-month preparation, every lady would ask for what they needed to carry it to the king, the night they were to be with the king. So I'm imagining the ladies would say, make for me a robe made of royal purple and embroidered, I'll iron it well and fold it. And that will be the gift for the king. I'm sure he'd love it. The king loves the finest of things. Another one would say, maybe I want sandals from another kingdom. Let it be imported, brought to me. I'm going to package. There's nothing like this pair of sandals in this kingdom. I'll present to him, So everyone thought carefully what they wanted. But strategic planning ensured that Esther had favor with Haggai. And Esther did not want anything except for what Haggai suggested. So we don't know whether Haggai suggested something material, or he suggested a plan of what Esther could do that was immaterial, but would win the king's heart. In my wild imagination, I thought maybe Esther did not go with anything material, because the king was wealthy. He had everything. This is a man who had pearls, mother of pearl, on the pavement and precious stones. This is a man who had a couch of gold. What could he possibly need more in matters material? So there's a possibility, Haggai told her, just go with this bowl of grapes, eat with him, talk about this topic. He loves that. He loves that attention. That is his love language. Just talk with him. Open your heart to him. Make him laugh. Make him smile. Just make him happy. That is all he needs. He's lonely. So he does not need material things to feel that loneliness. He needs your attention. He needs your heart. He needs your presence. Just go and talk about this. That could have been all that Haggai suggested to Esther. And that was the deal breaker for Esther. So I'm thinking of all this. This was planning. This was well organized. This is what got Esther in as the queen of Persia. Now, I could go on and also discuss about Mordecai, because I say the whole book is about strategic plan. Things were well organized. So let me just touch on Mordecai. He's a gatekeeper, not just any gate, the king's gate. Meaning the gate where he was stationed is where the king would go in and come out, go in and come out. Now, he was in close proximity also to the doorway. Now, for you to know that this palace was huge. So if he was able to be close to a doorway where he had the two assassins discuss of how to kill the king, he was able to hear that plot. That is the plot he uncovered, and at the very end led to his promotion. So he was strategically positioned to hear what the assassins were planning. The same gate where Haman would be had demanded to be bowed upon, for the officials to bow before him, because he would pass through that gate whenever he entered and he left. So he was well positioned. What if Mordecai was a cook or a cleaner or somewhere else? This whole event would not quite have worked out. And yet it was needed to bring about Mordecai's promotion and Haman's annihilation. So he was well positioned. Again, being inside there at the king's gate, it gave him the chance to be able to check on Esther at the courtyard every day to find out how she was doing. Is she okay? So everything was well organized until Mordecai got to be the second in command and able to save the Jews, his people. Now, ladies and gentlemen, you are seeing, and I'm not even done. There's still about Haman, how events unfolded until Esther became queen, one. Mordecai became second in command. Wealth was transferred to Esther. Mordecai became the one overlooking this wealth. In the very end, Haman, the one who wanted to annihilate the Jews and commit that genocide, gotten rid of. And the very end, the Jews got an upper hand because now Mordecai cared about their affairs in the kingdom. Go ahead and read the book of Esther. Pick out all this, the way things are well coordinated. And come back now. Let's talk about the crash cart, the emergency cart, the cord cart, and how well it is planned for emergency cases. Now, like I've mentioned, our cart here, our emergency cart, is a rectangular shaped box. And this box is either made of metal or hard plastic, tough plastic. Now, it contains everything that is required for a life-saving event. So life-saving could be that if, like I've said, in the hospital, it is a rectangular box. Outside, it is the ambulance itself contains these items that are in the emergency cart. So you could say the ambulance is our mobile emergency cart, right? Now, being rectangular shaped, it has 4 wheels, the one in the hospital. Now, let's focus on the one in the hospital, since I've said the ambulance contains what is here. It has 4 wheels that allows, in case of an emergency, it can be pushed in a hurry. As the medics are running, they are pushing this cart and running along the hallways to get to the person, the victim now themselves. So it's rectangular shaped and it has 4 wheels. It can come in any color, commonly red, but they are gray, there's white, it doesn't matter the color. Just know that there must be an emergency cart. Now, inside the hospital wards, maybe medical ward or surgical ward, at least you must have an emergency cart. So you're not just depending on what this team is running with. They will run with the emergency cart. But inside every ward, there must be an emergency cart. Reason being this: should a patient get into an emergency, the nurses will not wait for that team to arrive with their cart. They will start their own emergency saving measures upon the victim. And when the advanced team now arrives, they will continue from where the nursing team had started off with. Or even there may be doctors in the ward when this emergency is happening, or other healthcare team members. They have the permission to start. They'll open this emergency cart and start performing emergency services on this victim, while the team from the emergency room or ICU are coming with their own cart and continuing on from where the nurses were or what they were doing. So let's look at this cart. In front of the cart, it has drawers. You know the drawers that you have maybe in the bedroom? You would pull one drawer, you have your socks. You'd pull the next drawer, you have your ties. You pull another one, you have something else. So imagine that kind of drawer where you're opening and you see what is there. Then you open the next and you see what is there, like that. So that front part of the emergency cart has these small drawers. And the bottommost drawer is normally much bigger. So that is the front part. But it has to always be locked. Now, it is normally locked, sometimes with a key, so that when you're trying to open each drawer, you can't open unless you turn open the key, then you are able to access the drawers. So some are closed by a key, one key, and then you can't open the drawers. Others, it is just a flap, and then it is sealed, something like a padlock, but not a padlock per se. A seal that can be easily broken, plastic made, so that in case of an emergency, you simply snap open that seal, and then you are able to open the drawers. So it has to always be closed and only open during an emergency to access the drawers. We'll see why. Now that is the front part. On top of our emergency cart, and the top is as high as maybe waist high, because you're supposed to be able to access the top without straining or even bending too much. So on top of this cart, you have what we call the monitor or defibrillator. Now, remember our AED that would probably have a screen giving you information or a voiceover telling you press this and press that. But now this is an advanced AED in the hospital setting. It is advanced because it has various things that the medics, the healthcare personnel, understand better. So on the screen of this defibrillator, you have what we call the monitor. It monitors the electrical impulses of the heart. So it can tell you whether this is a normal heart beating, or the heart is too fast, too slow, vibrating, or it's not working. It gives various heart rhythms that the healthcare personnel understand, because they've learned that when you see this, it tells you the heart is doing nothing at all. And it is called a systole or a flat line. When you see this other one, the heart is beating normally, the patient is fine. And on the same screen, you'll see the blood pressure of this person. You'll see how the pulse, how fast the heart is beating. When they are connected to a probe, you see what is the oxygen level, 90%, 95%, 98%, or 78% needing intervention. Excuse me, and on and on. So the monitor has details about this patient that the healthcare personnel are able to tell what is going on, right? It also contains the pads. Remember our pads in AED, we were sticking on the patient to shock them. There is also a pad that you lift from the defibrillator, shock the patient, and then put it back and continue your CPR. So this is what we call what? A defibrillator. It is always on top of this emergency cart, and it must be there. Everything we're discussing, it is paramount that it is in this emergency cart to at least be identified as an emergency cart or a crash cart. Now, other than this defibrillator or monitor, we have what we call a suction canister or a suction machine. So it is a machine that is connected to a container called a canister, and the canister is also connected to a tube. Now, the machine is connected by a tube to the canister, meaning when you turn it on, it creates negative pressure. It pulls. It creates negative pressure pulling, and this canister is a collection container that is connected to a tube. That other tube is what you now put in the patient's mouth, in their trachea, to try and suction, to pull out, even in their stomach or the esophagus. You're pulling out secretions to create an airway so that there's nothing preventing this patient from, the secretions are not preventing this patient maybe from breathing well, or if there's a lot in their stomach, like poisoning in their stomach, you want to remove. So the suction, this machine, when you turn it on, it pulls all this secretion, and when it's pulling it, it's collecting in the canister. Very important, and it is placed on top of the emergency card. Now, when I say this canister does not have to be on top, the defibrillator must be on top. But some emergency cards, you may find it on the side like that, on the side of the card itself. But I'm just describing that it could also be on top, which is a perfect place to be at, because it gives easy access to the patient. On the same top part, you may see what you call a binder. A binder is just like your file, a smaller file. And in this binder are documents. Now, there are different kinds of documents here, well organized. Remember our Bible story? And this card has to be organized so that you do not find it here and there. This binder contains various kinds of documents. So you may find a color code, that there's a blue page and under it are certain types of documents. Then you have yellow to show that these are different kinds of documents. You have black, like that, color codes, because in an emergency, you want to quickly be able to get what you need. So maybe the black one may have a flap written that these are algorithms, or written that this is a drowning algorithm or a cardiac arrest algorithm. I'll explain. And these ones now are the checklist, this like that. So that in an emergency, you are just identify what is this, flip it and pull out the document that you need. Now, ladies and gentlemen, one of the documents in this binder, like I've said, is a checklist. When you remove the checklist, you will see that it contains all the items that are in this crash cart. And this checklist has to, a nurse has to go through this checklist every shift, and in some facilities, they have indicated every 24 hours. The checklist has to be filled out and signed. So if you remember, I talked about a charge nurse. Sometimes it's the charge nurse's duty to do this. Whatever arrangement the facility has, the most important thing is that that checklist has to be filled every shift or every 24 hours. Nothing more beyond that. Not after 48 hours, not after 72 hours or 3 days. Every shift or every 24 hours. The importance of this is this. All these items in the emergency cart should be present and should be in good condition, so that in case of any emergency, remember we are only using it during life-saving emergencies, not any other situation, life-saving measures. So you do not know when you'll have an emergency, and you don't want to go to a crash cart and find that it hasn't been checked for the last week. So by the time you're trying to pull something, it has expired, or it was not plugged in, so it's not working. We thought these things are working. They've been sitting there. No one has been using them. How come it's not working? So it has to be checked. Is the defibrillator working? So a nurse in every shift will be turning it on, ensuring the monitor is working. The defibrillator and the suction machine have to be plugged at all times. So you will notice that even the positioning of the entire cart is in a certain place in the ward. It is always in a certain place, so that today you don't wake up that the emergency cart is in that corner. Tomorrow you wake up, it has been moved to the nurse's station. The next time you wake up, it was repositioned. Now we are finding it in the clean utility room. That cart is always stationed at a particular point, and should there be a need to move it for one reason or another, that information is communicated immediately, and everyone has to know that the emergency cart is now positioned at such a place. And to avoid that, after a week, now it is positioned here. After another 3 weeks, now we've decided to, as much as possible, it should be in one location. And that same place where it is located, there has to be an electrical socket whereby the defibrillator and the monitor and the suction machine are plugged in and switched on at all times. So during an emergency, before the cart is pulled, you ensure that you have unplugged and then pull off the cart to the emergency. So this checklist is when the nurse is checking, whether the registered nurse, charge nurse, they will be checking, is it working? Check. Is it plugged in? Check. Fully charged? Check. So everything about this machine, plugged in, the switch is on, I've turned it on, they're all working. The suction, I've turned it, not just turning and hearing the suction doing, oh, it's working. No. Checking, is it suctioning? Is it creating that negative pressure? Then she can check it and ensure they are okay. Is the seal that has locked the front drawers, what is the number on that seal? 45287. They will compare it with the list. The last check 24 hours ago, is it marrying? Is there, are they what do you call it? Are they the same? What is written and what is here? Because if they're not the same, that shows that it was open and another seal was put in place. And that tells her that, yes, there was an emergency the last 24 hours. So it was used, and she needs to write the new number that it was sealed, that is being indicated there. So then she will check other things. There's an oxygen canister there. I'm going to explain. So to ensure that it is full, is it present? First of all, yes, there is oxygen cylinder there. Oxygen level, is it full? Yes. Try and turn it on to ensure that some oxygen is coming out, not just looking at the gauge, because the gauge could be spoiled saying full, and yet the cylinder is half empty. And that is dangerous for a resuscitation. You don't know how long the resuscitation will take. And so you've gone there with half a cylinder. So it should always be full, check. It is present, check. The gauge is working, check. And then move on to the next item. So everything in the crash cart, there is always a check that the nurse now is confirming everything is in order before she signs her name and the date and time that she has done this. So that should there be anything going missing during an emergency response, they know where to go back to. So and so did the last check. How come she did not check this? And that is where the nurse is now answerable. They will not blame the ones before. They will blame the person that did the last check, that she did the check, but things are not okay during the emergency response. Now, having said that, that is our checklist, one of the documents in our binder. The next document that you'll find there is what we call a code document, meaning during the resuscitation, information has to be written. What time did the team arrive? What was going on? How did you find the patient? What was done for the patient? What time did you intubate? What time did they give one sort of drug, an epinephrine? What time did they give the second dose? There's a lot that goes on during an emergency response that has to be documented for legal purposes. Should there be a lawsuit, at least that document will be able to indicate the time they did this, how long it took for them to do it, what was given next, so that should, for instance, something go wrong, at least you can present and say, we did everything right, but the patient died, or we did everything right, that is in the record that this was done. Everything was done. Even during charging, when they charge the patient for that code response, at least it shows that, yes, this drug was used, this one was used, and it can be charged or billed to the patient. So those forms are there. So you don't want during a response, that is when you find out, oh, the documents are finished, run to the nurse's station, start printing, start photocopying to come to the code. It should be available to put the details in to ensure smooth emergency response. Another document that is there is what we call the algorithms. Now, these algorithms, in some institutions, you find them on the bedside, so that during an emergency, it is right there on the wall. And what it says is that in case there's a cardiac arrest, there's an algorithm for the cardiac arrest. So what the algorithm does, it's like a cheat sheet to help. During emergency, there's a lot going on. There are things that one may forget. So it is just easy when you see that, should there be a cardiac arrest, what do you do first? Give CPR. How many compressions? 30 to 2. After 2 minutes, do this. Is there any resolution? Then it's like a flow chart. Yes or no. So if you said after 30 and 2 compressions, is there any resolution? No. So it says no. What do you do if it is a no? Give epinephrine. So how many milligram? 1 milligram, like that. You've given. Continue doing this. So it gives a guidance in case of an emergency to at least help, because people can forget. Maybe the last time we had a code or a drill that's the importance of doing these drills, but it was a while ago. But with all these events, it is easier now. As you are doing it, somebody else is reading, so that in case you hear the person giving commands, the coach now is saying, give amiodarone to you who is looking at the flow chart. You can say no. And you are allowed. So you will not feel bad that I'm just a nurse who left nursing school a week ago, and here I am correcting the coach. Because you have the flow chart or that page, you are able to bring out the correction so that the wrong thing is not done during that emergency. And correction is allowed, because somebody else may confirm and say, actually, it is epinephrine, not this. And that way you will save the life. So the algorithms are in this folder, but other institutions have seen them on the wall, and that helps to at least, during any kind of emergency, there is a way to go about it safely. Another document I've mentioned, the checklist is there, the algorithm, and also the code sheet. Let me just stop there. But if at all there's need, like medications, pages of medication. So it has listed the medication, the standing orders, meaning in case of an emergency. Remember, nurses do not prescribe medications. They don't decide, let's give 10 milligram. No. So there is a standing order that in case of a cardiac arrest, the first drug to give is this, and this is the dosage to give. Then after 5 minutes, you can give another dose. So that is written in these pages, and it is also in the binder. So during a resuscitation, somebody who is not actively there can pull it out and also be able to confirm that what the coach is ordering is in line. And should there be, it's not correct, in a respectful way, but in an assertive manner, they can say it is this. So that the right drug is being given in the right dosage. Should they have said 100 milligram instead of 10 milligram, they are able to pick it out immediately. So those are the standing orders. They are given permission to give that, where the team coming with the doctor will come to take over. But more than likely, because this is the same algorithm, the team coming will still use. They won't come and decide, we are from ICU, we know better, we do. It is just a pattern that is normally followed during emergency cases. Now, let's leave this binder. Let's now talk about, these are just about the 3 things that you may expect to find on top, but the binder could also be on the side of the cart. It doesn't have to be on top, but at least this is what is expected in an emergency cart. Now, behind the cart, you may see 2 things. One is more or less like a bag with extra documents. These documents you're talking about here, extra photocopies are in there, so that should you have a long emergency, you've used 10 pages, because now this resuscitation has gone on for an hour and you're running out of maybe the code sheets. If you need extra, again, you don't have to run out to go and photocopy or pull out from the file. You simply go back behind the crash cart and pull the extra pages and continue with the documentation. So these documents, extra documents, may be found in a bag behind the crash cart. Again, behind, you will find what we call a flat board. You know the boards that you use to chop your things in the kitchen. Now imagine a bigger board that can be slid under the patient, because maybe they were, during a resuscitation, we talked of high quality CPR. You don't want to be pressing on the patient and they are pressing on the mattress, so all you're doing is bouncing the patient on the mattress. You want a flat surface that is firm, so that when you're compressing on the heart or the body is also compressing on that flat, hard, firm surface and creating an impact on that heart. So the board is normally placed behind the crush cut. You simply pull it out and slide it under the patient before beginning any CPR. That one is behind the emergency cut. Now, what if the patient was, the head of the bed was tilted when they had a cardiac arrest? They were watching TV or they were eating, and so they had the heart attack, the cardiac arrest. What do? Some beds, there is a lever that you pull. The moment you pull the lever, the bed goes flat with a bang. Boom. That way the head just flattens. There's no time for a remote control to put the head down, another button to start leveling the leg. You simply pull the lever and the whole bed bangs flat. Now it comes with a certain bang, one, because it is an emergency, we need to move. And another thing, that bang itself could also cause some kind of jerking on the heart. So that is how it has been designed. Should you get to the hospital bed, find out, is there such a lever? So that in case of emergency, you don't go for the remote. The remote may be that now there's a power outage. If there's a power outage, what do? Do you start now moving the patient to the floor? It takes time. So find out if there's a manual lever that at least complements that electrical remote control. So that board is slid under the patient before any CPR is done. Now that is what you'll find behind our crush cut. What about the sides? On one side of the crush cut, you'll now find that oxygen cylinder. It is not very big, something narrow, maybe waist high, and it is put on the side of the crush cut. Like I've said, it has to be full at all times. The gauge has to work at all times. It has to be checked to ensure that oxygen supply is available. Most hospitals have the oxygen connected to the wall. But then again, should there be an electrical power outage, things happen, or it's faulty, you always want to ensure that that cylinder is in the crush cut. Even if you should get to the room and start connecting the patient to this oxygen cylinder, it is okay. You may even forget that there's one on the wall. Use the cylinder. The important thing is that we have oxygen available. And should you not use this cylinder and instead use the oxygen supply in the wall, it is still oxygen. The important thing is that oxygen is available in this situation. Now, apart from the oxygen on the side, we also have a box of gloves, clean gloves. Not sterile. We normally have sterile and clean, but there has to be a box of clean gloves. Now, gloves that we wear on our hands before touching the patient and all that, it comes in various sizes, commonly small size, medium size, large size, and even extra large, because they're trying to cater for the size of the hands. So for myself, I use the medium size. Small is too small for me. Large, it is sagging. Extra large, of course, does not fit. So for me to work, I work with the medium. So in this crush cut, they will not have all the different sizes. Mostly, you will find them stocking the medium, at least to be average. Because it's an emergency, the person with small hands, at least they have, yes, it may be sagging, but I doubt it is too small. And the one with large hands, yes, it may be too tight, but I'm doubtful that it is too large. Unless, of course, in special cases whereby they may ask for the extra large, which is available in the clean utility room. So expect a box of gloves. However, in some hospitals, the gloves are right inside the room of every room of the patient, or at the door of the hallway, you'll see a box of gloves. At the nurse's station, we have box of gloves. So gloves are pretty much scattered. But then again, not every hospital is well resourced. So to ensure that you don't run out of any gloves, every emergency cart should have a box of gloves. So we don't assume it's in the room or in the hallway or in the nurse's station. That is one thing that you'll find on the side of the emergency cart. Now, right here where we have the defibrillator and here we have the oxygen, you will find hanging somewhere around there a plastic bag, and inside is what we call an ambu bag. An ambu bag, or a bag mask valve, meaning it has a mask and it is a bag that you press as you give oxygen, and a valve. Now, what this does is, do you remember when you were doing the CPR, we were giving 30 compressions, and with our mouth to mouth, we were using our mouth to give air, to the breathing, rescue breathing to this victim. So now that we have this emergency cart, we use the bag valve mask. We put the mask on the face and we compress that bag twice. So the compressions are going on 30 times. When it is time to give the air, we're now not using our mouth. We simply use our valve bag, the mask in the mouth, and we compress our bag twice. 30 compressions, 2 breaths. 30 compressions, 2 breaths. That is what happens now during our CPR. Now, apart from the bag valve mask, in this bag that is on top here, between on top and the side of the mask, sometimes hanging, we also have an extra pair of pads. Remember our pads for the AED? You will find a pair in there. So that should it be that you are lifting the defibrillator, something is happening, you always have the pad you can connect and still continue with the resuscitation. So you see now how important your pads were there, so that you will not say it is just a small machine, it doesn't do much. The same pads can still be connected where we were plugging it in. It can still be plugged on this monitor and do the same shocking that the other pad was doing in our AED. So you'll find that a pair of pads there. You'll find your BVM inside your ambu bag or your bag valve mask inside there. So all these things, you're seeing how well they're strategically positioned for ease. That when you get to the patient, you have your board, you slide it under, you have your BVM there to give the breaths, you have your monitor here to just turn on, you don't have to go and pull some drawers, they are all here. Suctioning is simply suction and they're here. When the canister gets full, you detach, pour out and continue suctioning. The gloves are here, you put it on and you start working. The oxygen cylinder is here, you simply connect the tubing and you attend to the patient, okay? Now, this other side of the emergency cart, you have what you call a sharps container, meaning anything sharp, the ampules, where you're drawing your medicine, there are some glass ampules. You have to break the neck and then use a needle to draw the medicine to give to the patient. This is a sharp glass. You don't want to draw and then throw it there. Somebody could get cut during all this thing, and then later on you start hearing stories. So you don't want any sharp injury. Every time you break the glass, you simply drop it in the sharps container. A needle that has been used, you drop it there with a syringe. So you don't go removing the needle from the syringe, drop the needle and then dump the syringe. No. Once you've used it on the patient and drawn it, it may be that you're still drawing another medication and all that, but normally once you've used it, you simply drop it in as it is. Now this sharps container is puncture resistant, meaning the sharps inside cannot puncture that plastic container. It is puncture resistant. And we do not wait for it to get full. Before now, we remove it and take it to the incineration room where it will be destroyed professionally and bring a clean one or an empty one. And when it is 3/4 full, that container is always removed, thrown out, and another one is brought in. But during emergencies, we do not wait for another emergency and another emergency before we say now it is 3/4 full. It will be automatically removed and then a fresh one will be brought in. So we have a sharps container for anything sharp thrown inside there. Then in some crash carts that I've seen, they have what we call a paralytic box. It contains medications that in case they want to intubate, put an airway in the trachea of the patient, they give this patient that paralytic medication to relax their muscles so that they do not force it back. Because it's an emergency, we need to get to the airway, things are happening, you could lose your life, you could lose your airway. So they inject that paralytic and it paralyzes their airway. So they have no control. Their body does not have control. For instance, if you take your finger and you try and put it at the back of your throat, you gag. You try to fight against whatever has entered. But when they inject that paralytic, it is impossible to do that. That way they are able to now insert whatever they need to in your airway and give you the needed life-saving oxygen inside. So that box is also always sealed because these are very sensitive medication. The seal has a serial number so that if it is open, it is clearly known somebody opened the box. Was there an emergency or was there any other reason why it was open and now resealed again? So all this, I think I have touched on the basic things that you should expect to see in an emergency cart or a crash cart or a cord cart. That is the outside part. We want to get to the inside of this crash cart, and I will quickly go through because it's been 1 hour. Now, in this crash cart, the first drawer, mostly, okay, now the sequence is not standard. But it is similar but not the same. When I say similar is that at least expect to see some changes here, that the first drawer may be medication, the second drawer may be airway, but in some institution, the first one is airway and the second one, medication. So it is not written in stone that it has to be that the first drawer is medication, second drawer airway, no. However, all these things should be in this crash cart. So quickly, let's look at the first drawer. Let's assume now with this institution, their crash cart, the first drawer has medications. I'm not talking about Panadol, Eno, for stomach, cough syrup. I'm talking life-saving medications, to mention a few. Expect that in a crash cart, you will have a drug called atropine. So that if this person is found that their heart rate is low, we call it bradycardia. It is slow and it is producing symptoms. Symptoms meaning they're feeling like fainting, they're dizzy, or they've passed out, something like that. That is what we call a slow heart rate with symptoms. Because athletes, like in my country, athletes, you may find an athlete, their heart rate, how fast their heart is beating, is so slow, 45. 50, and yet that is their normal because they do a lot of exercise. People who do a lot of gymming, when you count their heart rate, they have a slow heart rate, but it does not cause any kind of harm to their body. Their heart is beating okay, the blood is being supplied okay, so they do not need any emergency care. That is their normal. But if it is bradycardia, slow heart rate, below 60, and yet it is causing symptoms, we use atropine during emergency to bring it up. Because when it is slow, the organs, the tissues, the brain is not getting the needed blood supply. And that is dangerous. It can cause death eventually. We have another drug, aspirin. This is the exception. I know I've said no Panadol, no Eno, no cough syrup. But aspirin, believe it or not, 81 milligrams is so important. It causes the thinning, the blood to be thin, not thick. Because during a cardiac arrest or when the heart is too slow, that blood is becoming thick. When you put blood somewhere, expose it, it's not moving, it's not big. When it is just at rest, what happens? It forms a clot. So in an emergency where such kind of events are happening, you don't want that blood to form a clot. You don't want the clot to cause a stroke. You don't want the clot to go and cause a cardiac arrest. What do? You give that aspirin. So not all emergencies will you find the patient having cardiac arrest. It could be that they are having all these signs. When they check it is bradycardia, they need to act before a cardiac arrest happens, before the person becomes unconscious, before a stroke happens. So that is why we have this emergency card, because it contains these things to ensure that they either don't get to be unconscious or they get worse, but to be able to bring them to a near normal. So number two, we have aspirin 81 milligram. It can be chewed. It can be placed under the tongue because it is able to be absorbed quickly into the blood. It thins the blood, and therefore it prevents cardiac arrest. It prevents the clumping of the blood cells. We have another important drug that you shall find here called adenosine. Adenosine prevents the heart from beating too fast. So you may have what you call supraventricular tachycardia. The heart is too fast. When it's too fast, it doesn't have time to contract and push out blood and open up to receive blood, then contract again to push blood out into the body, into the brain and organs. So when it is too fast, we use adenosine to slow it down, just enough, between 60 and 100 beats to slow it down. Then we have what we call amiodarone. It is another emergency drug. Amiodarone is used when you have ventricular arrhythmias. So the heart is not too fast, not too slow, but it is in between. It's moving too fast, it's moving too slow, it's doing all manner of things. So when we have those arrhythmias, abnormal heart contractions and what have you, we give amiodarone. Then we also have what we call Narcan. Narcan or naloxone is given in case of a drug or overdose with an opioid. So an opioid could be a street drug like cocaine. Somebody has overdosed. Once you inject that naloxone or Narcan, they are revived. But it could also be a prescribed medication like morphine sulfate for pain. The person is in so much pain, you don't give them Panadol. They're given these strong drugs like morphine sulfate, which is an opioid. But should they have overdosed, maybe they took the first dose and they felt it's not relieving, the pain is too much, let me just take another one. They could go into an unconscious state. So to reverse that, they are given what you call Narcan, and it is in our emergency card. Then we also have another drug called, sodium bicarbonate. During CPR, the blood becomes more acidic. So that process, the cells, what have you, our blood should not be too acidic, it should not be too alkaline. So we give that sodium bicarbonate in order to now raise the pH so that we are not too acidic. It can lead to what we call metabolic acidosis, which is dangerous. So we are given the sodium bicarbonate, it is also here. Ladies and gentlemen, just because of time, we have what we call magnesium sulfate. We have what we call calcium chloride. If the calcium of this patient is low, again, they could end up unconscious in this case. So we need that calcium to take the calcium level high. And the same calcium, in case their potassium and magnesium is high, it brings it low to a normal. So the same calcium chloride is raising the calcium levels, but it is also reducing in case of high magnesium or high potassium. Another drug is procainamide. Another one is flumazenil. It reverses an overdose of benzodiazepines. But I don't want to just mention without giving you the meaning. Hopefully someday we will take time to talk about these drugs, the emergency drugs especially, to help you understand how important they are to be in this crash cart. So expect that in our first drawer, at least in this case. Now the second drawer in this crash cart, there are things to do with the airway. Remember, the person is unconscious. You want to be able to give them rescue breaths. So you've been doing a good job. Maybe now let's talk that you're outside in the public. You've been giving them 2 breaths and compressing them 30 times. 2 breaths, 30 times. The ambulance, our mobile crash cart, has arrived. What they will do, they look at the patient. If it is necessary, they will want to go inside. Yes, they have the ambibag, but they're thinking intubation would be more necessary. So they will need items to get into the trachea near the lungs now. Because when you're doing this, yes, it is good, but not as effective as if they're able to put a tube down, close in your trachea, so that whatever they're giving, it is enough and it is ensure that it is going to the right place faster. So you will need to get the tube there. So we have what we call airways, where they can put it in your mouth or your nose to keep that opening between the outside and the trachea, and then they slit the tube inside. Because if they try to do it without, it is a bit difficult. So we have the airway. We have what we call a laryngoscope. It has a torch, so they're able to move your tongue. The torch is able to visualize the chords, and then they're able to slip in whatever tube they need to slip in. Then we have the endotracheal tube. These are tubes that once put in, it goes and sits on the trachea, and they inflate a balloon so that it is held there. And then they're able now to give whatever oxygen they're giving there. They're no longer bothering about the two compressions, and at least now oxygen is running inside the trachea, even if they have to use the ambibag, but they know they're doing two, and it is going inside right into the trachea and the lungs. We have others we call various types of airway, anything to do with airway. The outside, we have a mask, non-rebreather mask. It's in this drawer. The nasal cannula, the one they put on the nose and the ears and connected to oxygen, that tubing, it is in this drawer. So matters, things for intubating the patient and delivering the oxygen, you find them all in this drawer. So that the nurse is not looking at drawer 1, it's not there, trying drawer 3, drawer 2. That delay should never be during an emergency. Third drawer, we have things to do with IV. IV meaning you will find things like the tourniquet. If you've gone to a clinic, they've tied something like rubber so that your veins are visible before they try to draw blood. If you've seen that, or to gauge your veins. So the tourniquet is in this drawer. Then the alcohol swab, where they swab quickly and inject. Sometimes in emergency, there's nothing like swabbing. You simply go in, So the swab is in this drawer. Then an IV kit whereby they'll find the cannulas. Now the needles that you normally see in a sick patient, whether it is here, whether they use it here, or other parts of the body. But the main aim is to get to your vein. That is why it is called intravenous. Intra meaning inside, venous means the vein. Inside the vein, intravenous. So when you have the tourniquet, you have the swab, you have the IV kit. Now we have different sizes of this cannula. That's the needle being put. You may see white cap, or it's blue or yellow. That means the size of that needle varies, because not everyone has the same size. You may use a very tiny one and it may not help the situation. So mostly in emergency, we use slightly big ones so that in case we need to send blood, blood cannot pass through the very tiny needle. In case it is blood, it goes through a bigger needle. So we have different sizes of that cannula. Then we also have what we call the blood collection vials. If you've gone to a lab for them to collect your blood, there are tubes, like test tubes that you saw in high school. Those tubes where they collect the blood. So once they put the cannula, they immediately collect some blood, send it to the lab. Somebody runs with it to the lab. It is given first priority because they want to find out. They do what we call ABG, arterial blood gas. What is the magnesium level, calcium level? What is the blood type of this person? So the machine does a very quick job, and then a response is brought so that if this patient was bleeding profusely, remember our needle is big. We have the fluids, which we are discussing next, coming in just to ensure that this person doesn't run out of blood. But in the next 5-10 minutes, the machine is detecting what is wrong with this person. So if they were in the ward, it goes to either ICU or emergency or the lab. They have that machine to do a quick analysis of the blood. And then they bring a response quickly so that they know, oh, it is calcium that is low. If it is low, we have the medication there, calcium chloride. You will give the calcium chloride. Remember our standing orders. So if they find the magnesium was high, give the calcium chloride. It will bring the magnesium down. If you found potassium was high, again, it is called hyperkalemia. Give that drug that we have discussed, calcium chloride. It will resolve and this person will be revived. Therefore, the life has been saved. The same blood checks the sugar level. It could be that they are in hypoglycemia. Their sugar is low. That is why we're having this emergency. In the medication drawer, amongst the list of drugs, we have what you call dextrose 50% or D50. It is a small vial with it's like taking a cup of sugar, mixing with water, but now this is made in the lab. When you inject it, it reverses the sugar level. So if they were in hypoglycemia or insulin shock, too much insulin that brought the sugar down, they have that emergency D50 and the person is revived. So just back again to this drawer of ours that has Matters IV. So our blood collection tubes, for collecting the blood. Once they collect, they connect the normal fluid to run to keep that vein open. The same drawer, we have what you call our saline flash. You could find it here, or you could find it where the medication are. Because those emergency drugs, once you inject the medicine, you send it with some sterile water. We call it saline flash, to send it to the heart quickly. Because when you inject, you don't want the blood to be the one sending it, and it's an emergency. But when you push some, let me call it water or saline or sterile water after the medicine, it flashes it to the heart immediately, where we need it to now revive this person. I'm sorry I'm rushing because I don't want to stretch the video too long, but like I've promised, hopefully, we are going to discuss these medications. But you have an understanding that there is a drawer for Matters IV. Now the following drawer has a fluid. Now fluid meaning, let me talk of three types. We have one called normal saline. That is what you normally see maybe when they're giving this person medicine. It goes in with the medicine. In case they need blood transfusion, the blood has come from the lab. They do not just give blood without this normal saline. It accompanies the blood. And we cannot give blood with another fluid that contains some sugar or some electrolytes and all that. We use the normal saline to give the blood. So this drawer has normal saline. It has another fluid called Ringer's lactate or Hartmann's solution. Now this Ringer's lactate now will have a bit of calcium, a bit of magnesium, a bit of electrolytes, but it is normally used when the person maybe has been burnt or they've experienced trauma, maybe a road traffic accident, there's trauma in their body. That is when now we use the Hartmann's. Now that they are in hospital, for instance, something has happened, maybe the ABG has come and this person is low on one electrolyte or another, Hartmann's solution is the fluid of choice because it also replenishes and does some good things in the body. Then finally, we may have D5W, similar to our D50 or our dextrose 50%, but now this one has a smaller concentration of sugar. So it has a bit of calories, and it may just also be able to be used as maintenance for this person who had hypoglycemia. Because you not just give them the dextrose and then continue giving them dextrose. No, you can give the dextrose, then maintain with the D5W with some other things. Ladies and gentlemen, I've touched on IV fluids. Let me talk of the last drawer. No, the big drawer at the there is a drawer that has now dressings. It has gauzes. You know, when they wipe maybe you have a wound, you have blood, you need some things to wipe, right? You won't use the patient's gown to wipe them. You won't use the bed sheets to wipe secretions, things that are flowing around and all. So we have gauzes, those gauzes of different sizes. Even the fluids that I've discussed are in different sizes. So you'll see a bag of 1 liter of normal saline, 500 milliliter of normal saline, 250 milliliters of normal saline, or a small bag of 100 mils. Normally we call it piggyback. So these three fluids, you see them in different sizes. So that if you don't need to use so much, but you need to use it, you don't take a whole bag just to pull out 10 milliliters. You go for the smaller bag to pull out. Now, the next drawer has our gauzes, it has our cotton wools, it has our bandages. Anything of that in that line, it is in their own drawer. And finally, at the bottom is a bigger drawer. That is where you'll find what we call PPE, personal protective equipment, so that you are able to cover your hair or put on the gown. You are able to put on shoe covers, or it contains even gloves, some sterile gloves, and even an ambu bag. Sometimes you find the ambu bag here instead of on top, or you find an extra ambu bag, but it is somewhere where we put now the bulky stuff that is required for an emergency. Now, you may say, emergency, what time do you have to put it on? What if it was the time of Corona? And this person has an emergency, because during Corona, people were coding, they were having cardiac arrest, they were having hypoglycemia, they were having all these heart rhythms that needed correction. Will you say because they have Corona, they have COVID, now we cannot resuscitate them? No. But we said before any emergency, you need to ensure safety first. Safety is paramount. So if this person has COVID, you don't rush in because you're saving their lives. You will get that COVID, and the person will remain with COVID. 2 of you will die. No one has helped the other. Or we will lose you and the person may be saved. But safety first, safety first. If it is a situation, whether it was COVID, whether this person has a very contagious disease that is like TB, for instance, where you need to have an N95 mask and all these things, you don't rush in because you won't be alive to help them. You need to be safe, love yourself before you love them. So at least you know at the bottom drawer you can pull it out, put only the bare necessary. Because even with TB, if you have the N95 mask, a special mask, you're good to go at least for that emergency. You don't have to put your cape, put your gloves, put on your gloves, put on your shoe covers before you attend to the person. Okay? So you put the bare minimum to save the life, at least you know you are safe. There we go, ladies and gentlemen. I'm very grateful that you've joined me in this episode. Time has gone. I've stretched you long. But at least now you know about the crash cart. You know about the emergency cart. Should you see anything similar like this in hospital, you know what it contains, life-saving measures. Once this cart is used in an emergency, it is not the nurses who go and stock it back. The whole cart is taken to the pharmacy. The pharmacy will go through every item. Remember our checklist. Every item, they'll go through it because they know that when they stocked before putting it in that ward, there were 15 of this, there were 5 of that, there were 7 of that. So if the 15 now has reduced, there's only 5 of it, they know that in this resuscitation, 10 items have been used. That one they charge to the patient. So the patient, when they're paying their hospital bill, they'll be paying for 10 of this drug, they'll be paying for 4 gauzes, they'll be paying, remember the notes the nurse was taking, they'll be paying for the medications that were used, how many needles were used, how many syringes were used. All that will be billed by pharmacy, and then they will restock and ensure that what was 15, that is now 5, has been replenished, and now it is back to 15. So that when the checklist is done, it will be just right. The right items required is available. Even the oxygen, they will put it back. Everything will be put together, and as soon as possible, it is put back where it's supposed to be, and the defibrillator and the suction machine are plugged back in. So now the nurse who comes for the shift, if they come in, they have to ensure that cart has been returned by pharmacy. There's a new serial number now they will register. They do all the checks again, and we have it ready for the next emergency. Whether it will happen again for that shift, or it will happen next shift, or the other, it does not matter. But now we have a ready crash cart. It doesn't have to be this crash cart that will be used for the next emergency. Peradventure, it is in pharmacy being restocked, and we have an emergency. There is that next ward. That crash cart will be dragged into that patient room and used and still charged. The important thing is that we have crash cart in our healthcare facility that are well stocked. Until next time, ladies and gentlemen, let me leave right now. Have a beautiful day wherever you are. Remember Esther's story, the importance of being organized, the importance of planning. Look at how well these things are coordinated. The medication is not at the bottom, and then we have the PPEs on top, and then we have this medication here. The next drawer, we have a different medication. Or the sharps container is so full, it hasn't been emptied. Or we have our defibrillator. It is there, but it wasn't plugged. No. Perfect coordination, perfect planning, well organized, so that during an emergency, things just flow and a life is saved. Until next time now, have a beautiful day. Goodbye.